Good afternoon, everyone. Thank you for coming. My name is Cole Waterman. I'm the Senior Manager of Government Relations and League Partnerships for the National Council on Problem Gambling. We're thrilled to be hosting this briefing today in collaboration with the American Foundation for Suicide Prevention, with the honorary co-host of the Bipartisan Senate Mental Health Caucus. Founded in 1972, NCPG is a national nonpartisan nonprofit organization that seeks to minimize the economic and social costs associated with gambling addiction. NCPG members include 36 state affiliate chapters and a wide variety of individuals and organizations, from counselors, prevention specialists, and researchers to people in recovery from gambling problems, as well as treatment clinics, gambling operators, vendors, sports leagues, state human health services. I like to say we're the hub of the wheel. We bring together everybody under the sun of gambling and try to find common ground. Our co-hosting organization is the American Foundation for Suicide Prevention, AFSP. It's a nonprofit established in 1987, dedicated to saving lives and bringing hope to those affected by suicide, including those who have experienced a loss. AFSP has local chapters in all 50 states, DC, Puerto Rico, and programs and events nationwide. Now, how many of you knew March is Problem Gambling Awareness Month? Well, before you got this invite, how many of you knew? Okay, I see Rob, Arian, couple. Well, now you're here to learn March is Problem Gambling Awareness Month, and it's not a coincidence that it's at the same time as March Madness, one of the most gambled on sports activities in the United States. Problem gambling is often misunderstood, and its impact goes far beyond financial consequences. It's a behavioral health disorder that can have devastating outcomes, including a heightened risk of suicide. That is particularly true for vulnerable populations such as military members and veterans who face unique challenges in accessing support. If you or anyone you know is struggling with a gambling problem, please call 1-800-GAMBLER. That's our number, and we are very proud of it. It's available 365. 24/7. So with that, I'm going to here to introduce our panelists. Our first speaker will be Vina Scheck-Snyder. She's the founder and executive director of the Arkansas Problem Gambling Council. She has over 10 years of counseling and business development experience in addiction treatment and recovery. She communicates with strategic stakeholders to create meaningful connections within various healthcare and government agencies. Vina also serves as a board member for the Arkansas chapter of the National Association of Social Workers. Thanks for being here, Vina. Our second speaker is Dave Yeager. Dave is an 11-year veteran of the United States Army in recovery from a gambling addiction. Dave uses his story and knowledge of gambling, particularly in the military and veteran communities, to raise awareness. Dave has provided gambling disorder training to clinicians for the United States Marine Corps, as well as U.S. Navy cadets at UC Boulder and the U.S. Air Force Academy in Colorado. Dave works directly with clients as a recovery coach counselor, and Dave is the host of Fallen, the Problem Gambling podcast for military service members and veterans, and the author of Fallen, a veteran with a gambling addiction. Our third speaker is Dr. Jill Harkavy-Friedman, Senior Vice President of Research at the American Foundation for Suicide Prevention. In this role, she leads a research program which funds research grants, offers workshops and training to researchers, and disseminates research findings to increase public awareness and support advocacy. During her 35 years as a clinician and researcher, Harkavy-Friedman has published over 100 peer-reviewed articles and trained clinicians nationwide. Dr. Harkavy-Friedman joined AFSP in 2011 and maintains a clinical practice in Manhattan. And our last speaker, but not least, is Mary Drexler. Mary is the director of the Maryland Center for Excellence on Problem Gambling at the University of Maryland School of Medicine. Ms. Drexler brings over 40 years in the social services field to her current role. As director for the center, Ms. Drexler has been responsible for the oversight of the center's initiatives in problem gambling prevention, awareness, treatment, and peer support, and public policy. Prior to joining the center in 2017, Ms. Drexler held the position of Responsible Gambling Program Coordinator for 3 years at the Maryland Lottery and Gaming Control Agency. So now that I got all that out, I'm going to pass it off to Vina first, and we'll move down the line with our speakers who come up, but there's going to be time at the end for questions, so please keep in mind your questions, because we'd love to have a lively question and answer period. So with that, Vina, I'll hand it over to you.
Thank Thank you, Cole. Thank you, everyone, for being here today. So as Cole mentioned, I am the Arkansas Problem Gambling founder and executive director. In that role, every day I get to service on, I'd like to say, 3 different levels. One is to advocate for services for mental health, including substance addictions, including problem gambling services. The second is to also train and educate clinicians like myself as a master's counselor of social work, and also other jurisdictions of counseling across the state of Arkansas and beyond, and also to sometimes be the clinician on the floor, as we say, right? And so also be able to have a helping hand to guide other clinicians with the issues that they may see for treatment with our clients and our residents. So defining problem gambling. The problem gambling is defined in the DSM as what we use, the diagnostic manual for treatment services, is the persistent and recurrent problematic gambling behaviors leading to distress or impairment, as defined by by the APA, as we call it. The symptoms may include increased amounts of money gambled, inability to control their gambling, chasing losses, lying to conceal gambling behaviors, preoccupations with gambling, jeopardizing relationships, careers, or education due to gambling, and also relying on others for financial relief due to gambling losses. Recognized as a behavioral addiction with significant mental implications. What that all means is that we see a myriad of behaviors from folks coming into services or asking for services and help that may include some of these symptoms, and sometimes in various ways of severity. The mental health impacts of problem gambling is increased rates of depression and anxiety from a mental health and behavioral health perspective. Studies show problem gamblers are twice likely to experience major depression episodes and higher risks of substance use. There is a correlation that we're finding through research and also through data gathered through different screening and treatment modules that's saying approximately 35 to 50% of individuals with gambling disorders also suffer from a substance use disorder, or like we call in the industry, co-occurring treatment. Mental health impacts for problem gambling also include suicidal ideations and self-harm risk. Nearly 17% of problem gamblers report attempting suicide at some point, compared to 0.5% of the general population. Financial stressors also are one of the signs that we also see clinically related to problem gambling, of course, with leading to family breakdown and homelessness, kind of leading to what we call some of those social impacts and costs. Saying over 30% of individuals in gambling treatment report severe financial distress leading to eviction or homelessness. I know definitely in some of the clinics that I serve and see, we are seeing the need for more education around financial literacy before it gets to that point of prevention for financial stressors and hardships. Gambling addiction and social work through the framework. As a social worker, we look at things in 3 different lenses. We like to say there's a micro level, a meso level, and a macro level. And so I just kind of generally highlighted what gambling throughout the framework can look like. For the micro level, individuals and families impact, especially on their behavioral health, or we like to say mental health, the financial stressors, and also the social relationship strains. Through a meso level, community effects, definitely workforce instability. I'd like to say that I've taken several calls with those, definitely with EAP, employee assistance programs, with clients coming in saying that they've had issues with not reporting to work on time or leaving work early to pursue gambling parents. So that's definitely something that we're looking at, and definitely criminal justice involvement. On the macro level, we see policy and societal implications, economic burdens, and public health risks and responses. which leads to the social cost. The social cost of family impact of gambling addiction, estimated $7 billion in social cost in the U.S. annually, including crime, loss of productivity, and even bankruptcies. The impacts of families includes a surmountable point of risk for divorce, child neglect, and domestic violence abuse. Arkansas and other southern states are, I would say, more particular and higher vulnerable risk due to economic disparities and increasing gambling access with the technology. The need for research and targeted interventions. Definitely a lack of research for youth gambling addiction prevention and treatment resources. We're seeing an increase with technology with some of the early gaming apps, right? Not necessarily gambling, but maybe gaming apps for youth, and the prevalence of that risk is greater. And also with our older adult Americans, we're seeing definitely some increased risk with them as well for age-specific prevention strategies and target intervention programs needed. And then also our other populations include first responders and military personnel that are at higher risk due to stress and exposure. And also, again, increased with the age and prevention strategies and intervention programs that are needed for research and development. Collaborative efforts for funding and awareness include state funding for treatment, research, and prevention, partnerships between mental health professionals, social work, and other counseling agencies, and definitely policymakers. And then our public awareness campaigns leveraging social media and technology. I like to say that there's a lot of innovative ways that we can market and also to get out the word for things like PGAM right now, and also all throughout the year for services to be available and for those to know that what the risks are associated with it. And now I'd like to turn it over to my esteemed colleague, Dave Yeager, who will talk about the effects with the first responder and military population.
Thank you, Vina. A little loud. My name is Dave Yeager. I'm an 11-year veteran of the United States Army, and I'm in recovery for a gambling addiction. That journey actually started in 2001. I was stationed here in the States, married in my first marriage, 2 children, 3 and 5 years old, and came down on orders for Korea, which was not a big deal when I came down on those orders, except that then 9/11 happened and I was getting ready to get on a plane a month and a half later. There's a lot of stress in my life. My first wife and I had been arguing back and forth because of the things that happened that created the stress. I had 2 young children I was going to be away from for a year. But I got on the plane because that's what I did, because that's what I raised my right hand for. So I got on the plane, I flew into Osan Air Base in Korea. First thing I noticed is that there's missiles pointed at the plane, which was very uncomfortable. It was a very stressful time because we didn't know what to expect on the ground. So we get there, I get off the plane, they put us on a bus, they take us to Yongsan Base in Seoul so we could process in, and then I could move on to Busan, which is where I would be the non-commissioned officer in charge of 2 squads, one in Busan and one a couple hours away in Daegu. So I got into Yongsan, I processed into the hotel, I dropped all my gear. I was tired, but I wasn't ready to sleep because I was under a lot of stress. So I start walking around the hotel, and as I'm walking around the hotel, I'm hearing some noise, so I look in, and lo and behold, here's a casino-style slot room right there on the military installation, right there in the hotel. I didn't know they existed because they don't exist here in the States. They're just overseas, and they're done for morale, welfare, and recreation for MWR purposes. So I'm like, okay, I grew up in Pennsylvania. I used to go to Atlantic City in my 20s, and I would spend some money and be fine. Let me spend some money until I feel tired, and then I'll go to bed and start my journey. So I took a couple $100 out, and I went and I sat down and I started playing, and it wasn't too long before I noticed that my shoulders started to relax a bit, and I felt a little more comfortable, and I'm like, okay, I'm going to be able to sleep. And then I made probably the biggest mistake a budding compulsive gambler could ever make, and I won. And it wasn't, I didn't break the bank, I didn't get thrown out of the room, but honestly, I can remember right in that moment, all that tension, all the stress, all the hurt, all the things I was carrying in that moment just washed away. And they didn't go away forever, they washed away in that moment. And I'm not going to say that I became an addicted gambler in that moment in November 2001 sitting in that room. What I will say is a seed was planted. Because it felt so good once I got down to Busan and I got settled in down there, I met my team, I got into my housing, and it was a few days later, I was in the community club there just to relax on a Friday night, and lo and behold, here's another one of these rooms. It's much smaller, it's not nearly as lit up as the other one is, but I'm like, okay, I had fun up in Yongsan, why not try this again? So I did. And that Friday night, over the course of about 3 months, led to Friday, Saturday night, Friday, Saturday, Sunday night, weeknights now, and over the course of time, it moved from this is fun and I enjoy this to I want to go there because this is my fun escape to I need to go there to I have to be in this room. I have to. It became an obsession, right? Now, alongside of this obsession is I'm developing soldiers. I'm getting them promoted. I went out and got my expert field medical badge, which was, at the time was one of the hardest badges to get in the Army. I was developing a training system that my command and SOL wanted to use for other squads throughout the peninsula. So all these great things are happening while alongside of it was this growing obsession, right? That I had to go, I had to be in that room. It was my safe place. It was where I could go to not deal with all the stresses of life. What I didn't realize was that slowly but surely, physiologically and emotionally, this was taking me over, right? It was literally taking me over to literally the point where I felt like I couldn't not do it. It got to the point where, over the course of those months, it went from, I had my wife send me more money, giving her different excuses, to when that dried up, I sold everything that I had brought with me for the year, to then borrowing from my own subordinates, which you do not do as a non-commissioned officer in the military, to then stealing from my own unit. And it wasn't much money, it was a very small amount of money, but it didn't matter. I stole it, right? And an investigation was started through the Criminal Investigation Division, CID, and I told them, stop where you are, I did this. I was so ashamed of what I had done. So they immediately took me out of my position, and rightly so, and then they sent me back to Seoul to get me processed and disciplined. And I remember sitting down in front of my commander, my colonel, and him saying, we really don't know what to do with you. There's all these great things you're doing for our unit, and then there's this character piece and this money piece. And the thing I don't remember hearing is the word gambling. And I think that's one of the things throughout all of this time was that I don't think there was an understanding among my command or among the military that gambling is an addiction and that it can do damage as an addiction and that it's treatable. So I got moved on to my next unit. This continued. I went to South Carolina. I was stationed remotely in Mullen, South Carolina. During that time there, I came down on orders to go to station again remotely at Naval Air Station Corpus Christi outside Fort Hood, Texas. During that time, I had become so detached from my wife and my children that she decided she wanted to separate from me. She didn't know exactly what was happening. Also during that time was the first of 4 attempts on my own life, because I was getting to a point where I didn't know what was wrong with me and I didn't think anybody could possibly understand it and fix me. So maybe it was time to just end it and be done with it. So we did end up separating. I did end up going to Texas, and it built right back up again to the point where I was actually let out of the Army this time. I ended up, after my second attempt, I ended up in a acute psychiatric hospital for 2 weeks, during which time my commander and my officer in charge came down, sat in the conference room of that psychiatric hospital, and told me I was being released from the Army. And my commander said, we're going to let you out under honorable conditions so you can go get the help you need. What I didn't hear, and unfortunately, and it wasn't my commander's fault, I don't think they knew. They wouldn't tell me what that help looked like, just that you can go get the help. I'm grateful that they let me out under honorable conditions because they could have done much worse, and rightly so. They would have been in the right to do it. I accept all the things that I did, and I accepted the punishment for what I did. I just wish that there had been a better understanding that this is an addiction and it is treatable, because in the military, drugs and alcohol, depending on the severity, there is treatment available for soldiers, sailors, Marines, airmen, whomever, to be able to get back out, because any of those addictions impact readiness. They impact military readiness, they impact unit readiness, they can impact national security. So, security clearances are at stake. But if you can treat somebody and you can catch it early enough, we have a chance. I may have had a chance to salvage my career had I known more that this was an addiction. And I guess part of me kind of wishes I had that chance. So it led to my release from the Army. And then for several more years, I was in the addiction until I finally found the gambling treatment program at the Cleveland VA. It's the oldest residential gambling treatment program in the country, actually founded by one of the founding members of NCPG, Dr. Robert Custer. And finally, after 6 years of struggling, somebody finally understood what I was going through. The problem was, I had all these healthy things that I was doing, but I didn't hold on to them until eventually I relapsed again in 2020. From that relapse, what I learned was, if I don't stay in contact with what I need to do for my recovery, so I do a lot of self-help groups, I wrote a book, I did a podcast, I do all these things to stay connected to my own recovery. If I don't do these things, I run the risk of going back into my addiction. And my hope and my wish and what I do now is to help educate people that, number one, this is a very real addiction. Number two, it moves along a continuum. We don't snap our fingers and become addicted. And that number three, there is treatment and help available. That's what I do today. It's why I do what I do today. And I'm very grateful for the time. Thank you. I'm going to let you introduce yourself.
Well, this always happens. Thank you so much, Dave and Vina. I'm actually sitting here wondering, how many people here know somebody who's had a problem with gambling? Okay. And how about with suicide? Okay. Have you ever talked to anybody about those things? Have you ever had a conversation about, I'm not Dave, that I know. Okay. These are two things that not that long ago people didn't talk about. But that's what we're here about today, because they're both related to mental health and wellness. So we have two questions that we're thinking about today, or I'm thinking about because I'm here to talk about suicide. Do people with problem gambling have a higher rate of suicide? And do people who die by suicide have a higher rate of problem gambling? Those are two different questions. So most adults in the country gamble. At least 85% have gambled at least once in their life. I'm not very good at it myself, but you never know. 60% have gambled within the year. In terms of the problem gambling disorder, the disorder that Vina described, 1 to 2.4% of people who gamble have gambling disorder. That means that those people have a long-standing pattern of gambling more and more, all those symptoms that Vina described, gambling more and more to get the same effect. They can't stop. They're thinking about it all the time. Gambling relieves their stress. They're lying to cover up, and they're causing problems with money, people, and work. Basically everything that Dave just said. And the other thing is that it often co-occurs with other disorders. So people who have issues with gambling, often there are negative attitudes about it, so they don't talk about it. They feel that nobody will understand. It is a mental health condition. The Diagnostic Statistical Manual for Mental Health Disorders is solely there to describe mental health conditions. This is a condition, it's not a choice. And I think that's one thing that people think it's a choice, so they don't talk about it. But look how many people raise their hands in the room. So why? Because it brings negative attitudes. People have really negative attitudes about people who have trouble with gambling. So it's a kind of funny thing. They gamble, lots of people gamble, but then they're negative about people who have a problem with it. Also, it often causes problems in finances, intimate partner strain, difficult relationships with others, and poor work or school performance. Again, everything that Dave experienced and that Vina described. So what's the association with suicide? Because clearly, most people who gamble don't die by suicide. But about 31, and I just want to say, the research is very sparse and not that great. So I'm going to cite some things, but please take it with a grain of salt because we really don't know. This is a very understudied area. But with the little we know that about 31% of people think about suicide. About 17% of people have a plan for how they would take their life. And about 16% of people have made, with problem gambling, have made a suicide attempt. That's almost double for most people. It's much higher than the general population. And among people who died by suicide, about 4.4% were reported to have a gambling problem. But please note that there's a lot of missing data, and also the data that these information come from the police, the medical examiners, and the hospital. So unless the police or the medical examiner, who don't know what the questions they're supposed to ask are, unless a family member or witness knows about the gambling disorder and then tells them about it, it's not going to be reported. So I would like to say that it's probably way higher than 4.4%. So what may lead to problem gambling and the association with suicide? And a big one, which also Dave mentioned, is a barrier to asking for help. And you feel embarrassed, humiliated, stigmatized. Nobody will understand. There's a negative impact of gambling, right? Trouble with work, trouble with friends. And then the big thing that you heard Dave talk about, but as an add-on, is all the other mental health and other factors that people who have gambling disorder might also have. The mental health disorders, the physical health disorders, family history of suicide or mental health conditions, trauma, childhood or adult abuse. So there's never one cause of suicide. Problem gambling in and of itself is not a cause in and of itself, but it's often associated with all the things that Dave mentioned. Substance use, impulse control disorders, mood disorders, impulsive or reckless behavior, things like attention deficit disorder, personality disorders, trauma, and adverse childhood experiences. Those are all often combined with problem gambling. So we also know, and we know now because Dave just told us, that actually military and veteran populations have increased risk for both pathological gambling and suicide. But this is so understudied. We don't understand it at all. We barely know how to treat it. We have very few treatment facilities where people can go and get help. I'm so glad that, Dave, you were able to get help. So we need more research, more treatment, and more access to health care. Research is needed in several areas. What factors contribute to pathological gambling? Like, why did Dave end up with that and other people don't? Treatments, developing treatments that work. Connection, what's the connection between pathological gambling and suicide and suicidal behavior? How do we help service members and veterans who might be at even greater risk? And to save lives, we need a commitment to research and clinical care to address both pathological gambling and suicide. So, do people who have problem gambling have a higher rate of suicide? Yes. Do people who die by suicide have a higher rate of problem gambling? We don't really know. Maybe no, maybe unknown, maybe higher. So, for all these reasons, we know that pathological gambling is associated with suicide in the context of other contributors. It's not just an entity unto itself, but we don't understand it, and we need to. Mental health and substance use conditions, chronic physical illness and pain, all these things also contribute to both problem gambling and suicide. And then if you couple it with stress and access to lethal means, it can lead to a person taking their life. So please, if you know somebody who's struggling, have a conversation with them. Let them know that you care about them. There's no reason to be embarrassed. It's a mental health condition, and there's help for them. And these are numbers that you can call to get that help. Thank you. No, it's
Had a bit of a longer walk, sorry for a little bit of delay. My name is Mary Drexler. I am the Director of Operations for the Maryland Center of Excellence on Problem Gambling. We are a program of the University of Maryland Baltimore School of Medicine. I'm coming from a little different perspective today. What I'm going to provide is an overview of gambling and problem gambling from the perspective of what's happening in the state of Maryland and what the center is doing in the state. So, and how it all began, the Maryland Center began operations July 1st, 2012. And that was to address the expansion of legalized gambling across the state of Maryland. Authorizing legislation provided for funding for the services of the center, but also for a problem gambling treatment fund, so that individuals in the state of Maryland receive no-cost treatment, and so do their family members. So that is available to all Maryland residents. Our mission is to promote healthy and informed choices regarding gambling and problem gambling. We work very closely with the gaming industry. So this is just a snapshot of what we have in the state of Maryland. We have 6 brick and mortar casinos in the state, 27 online and in-person sports betting contractors. We have online fantasy sports. We have 13 licensed bingo halls. We have a very strong lottery. We also have the horse racing in the state's 7 off-track betting sites. The horse racing is regulated by the Maryland Racing Commission. However, the other entities are regulated by the Maryland Lottery and Gaming Control Agency. So in Maryland, we don't have a separate lobby. And gaming, it's one. It's the Maryland Lottery and Gaming Control Agency. So what do? We do a lot of things. We do public awareness. We do campaigns through social media, TV, radio, public service announcements, community outreach. We produce awareness materials. What we do notice is when we have enough in our budget, when we do a paid campaign, our calls, chats, texts go skyrocketing. When people are reminded on a regular basis of what is available to help, they utilize those resources. We do prevention programs at the, really targeting the full range on the age continuum. I'm very often to at-risk groups, if we're aware of any groups that are struggling in particular with problem gambling. Public policy, we provide information regarding strategies to address the impact of gambling on public health. We really want people to see it as a public health issue, like we see a whole lot of issues. Research, we have a research component that provides evidence-based data on public health aspects of gambling disorder, developing evidence-based strategies that we can use for our prevention and intervention practices. We do free training. Everyone loves free training with free continuing education credits. We do about 40 to 45 webinars a year in a fiscal year. We also do in-person training, and we will do training at certain providers, behavioral health organizations across the state. My favorite is our peer recovery support services that we have in place. We currently have 5 certified peer recovery support specialists that work at the center. We're one of the only states that actually has peer recovery support specialists as staff. And these 5 individuals, of which we would love more peer support recovery specialists, are currently working with 600 active Marylanders who are requiring their services. And since its inception late in 2017, we've served through our peer program over 2,000 Maryland residents. And then we have the helpline. 1-800-GAMBLER has been the line for Marylanders to call, but it is a number now also used at a national level for calling for help from anywhere across the country and getting connected to those services in that whatever state you are calling from. Okay. Also, since the inception, Maryland has every 2 years, it was legislated for every 5, but every 2 years has conducted prevalence studies. Data from 2022, before the onset, and that was before sports betting and mobile sports betting came to the state. So the study was completed before that happened. And what was identified from Marylanders is 74% of Marylanders participated in casino gaming, 82% in lottery, and 30% in sports betting, and it wasn't legal yet. But that's what they were reporting. We did do a 24 study. That data should be out by the end of June of this year and published. But since we've seen mobile and online sports betting, we've seen an increase in Marylanders reaching out for help. So an increase in calls, chats, text from a younger demographic, specifically young adult males between 18 and 24. And although you have to be 21 to participate in sports betting in Maryland, college-age youth are engaging in sports betting and are reaching out for support, as are their families. We're getting more and more calls from families, parents of college-age youth, very concerned about where the money's going. And as it became more and more apparent, high schoolers are also gambling. We're doing a lot with some education with high school teachers and high school students themselves, and our peers go in and share their stories. So I just wanted to share one story. It looks different for everyone. Problem gambling doesn't look the same for everybody. But we had recently, in this legislative session, a health seeker join us in Annapolis to testify on a gaming bill. He shared about how his 20-year-old son's gambling impacted his entire family. He shared about the more than $10,000 his son lost gambling in just a few weeks. He shared about, and also how his son's personality had changed. And he became more preoccupied with chasing that win, wanting to keep winning. Although his love for his son has never changed, their relationship had definitely changed. His son was hiding and lying about his gambling activity, and now they're working hard to rebuild their relationship. The father reached out initially through the helpline and was directed to one of our peers, and the peer has been able to point him to a variety of resources. The son, now in his mid-20s and in recovery, has a new sense of strength and hope and has begun the first Gamblers Anonymous meeting specifically for individuals under the age of 35. It currently has 40 participants that are participating in the state. It's the first in the country for this specific age group. And to our dismay, there aren't enough things for young adult males or females to deal with the addiction. So I wanted to talk briefly about one of the tools available. It's available in many of the states, the Voluntary Exclusion Program. It's one way for gamblers who identify that they may be developing a gambling problem, and to get help is one tool to maybe curb their gambling activity. In Maryland, there are close to 3,000 individuals on this list currently. And we go for 2 years and lifetime for banning yourself from any legalized sports betting. And there are other online tools such as GamBan, which is a tool to access online gambling sites, and also BetBlocker, which is a UK registered charity, which is a free service to anyone that they can block gambling sites. So I wanted to thank you today for allowing me to speak and giving an overview of our state's perspective, and helpful to try and understand the potential impact of legalized gambling in states as it continues to expand. Thank you very much.
Thank you, Mary, so much. And thanks to all our panelists. That was excellent. So we want to open it up to questions now. Please don't be shy. We have experts here who can answer. Please don't be embarrassed if it's a basic question. We're ready to answer those as well. So, anybody have questions for any of our panelists? Darian.
Hi, my name is Darian Harbeck. I work for Congressman Paul Tomko, and I lead his work on the Supporting Affordability and Fairness for Every Bet Act. A lot of the conversation today has been about the responsibility of the individual. And when you talk about this being a public health crisis or issue, I think like what we're trying to focus on is the nature of the product itself. I mean, this is a highly addictive product. As legalized sports betting rolls out, continues to roll out, they are using tactics that they don't use in the UK anymore because they know that they are harmful to vulnerable populations, young people, but they're targeting college kids on campuses. So I wonder if you could speak to the prevention side, beyond just educating individuals about how they themselves can engage with the product, but how the industry is also fueling this rise in problem gambling.
Go ahead, Mary, I see you.
Okay, am I here? Okay. I guess what I can respond to is, when I mentioned we do some public awareness campaigns, I wish we could do what the industry side is doing and being able to keep it and that public advertising going and engaging people by giving free tokens, free bets, and what people aren't realizing is it's really not free. It's not to their advantage, and we can't keep up with it. Our funding allows us to maybe do 3 to 4 months of paid, public awareness across the state. I do know we are not at the center for or against legalized gambling. We will advocate for things being done responsibly within gambling. So I make myself very aware to the Maryland Lottery and Gaming Control Agency on products and educating lottery staff and gaming staff. So we try and work together to make sure it is much more responsible. But you're right, there is an individual responsibility, but there's also a responsibility on the side of the gaming industry to make sure people are aware of the risks of gambling, even to the point of when you go to a web page for something that's mobile or online, the 1-800 number is so small, it's like I wouldn't even know where to go for help. We really need to set some guidelines that are national, that people are well aware right when they go in to make the choice, and people can make that choice to keep it safe. So.
Thank you, Mary. Sure.
Hi, my name's Rebecca from the Office of Congressman Suhas Subramaniam. Firstly, Dave, thank you so much for sharing your story, and I'm really glad that you're still here. And also, Mary, thanks so much. As social workers, I also majored in social work, so it's always good to have this. Yes, exactly. This might be one of those basic questions, but what do those gambling problem interventions really look like when somebody does go for help? You're saying that there are a lot of resources. Could you just explain more about what those resources look like?
So her question was about interventions for problem gambling. What does it look like, and what do the resources look like? So which one?
I can talk about what it looks like, and honestly, we don't know that much about what it looks like because we need more. I have to keep holding. We need more research, and we need more treatment development. But what we do know is that it's important to have face-to-face component, an individualized component, and some of the cognitive behavior therapy treatments are seeming to be effective. Often this cognitive behavior therapies are effective when you add a component that addresses this kind of problem. So for suicide, for instance, CBTSP, cognitive behavior therapy for suicide prevention, is much more effective for preventing suicidal behavior because it gives you the tools to actually manage the behavior. And so far I don't know that we even have a CBT for PG. We would need one. But those are the only things we know right now. And it's also being addressed separately, but it's all part of a person's whole makeup and whatever's going on with them. So it has to start with a full evaluation and assessment.
Vina, did you want to weigh in?
I do, yeah. So I'd like to say that with the continuum of care, right, it works across, as we like to say, it takes a village in Arkansas and throughout the South. The communications and the coordinated effort of communications between all of the parties involved, the family, the loved ones, the affected person, the clinicians, the other mental health staff, and then also the gaming industry, right? It's going to take all of us with very, I would say, innovative technologies, just as we see with the marketing tools and things that are out there for messaging. Also through like what Mary talked about with the different apps available right now as tools to help block some of that messaging. And then also keeping connectivity to the communities is really, really important to show support for the person or loved ones and families to continue being involved, right? So it's not just like a one and done, you're not cured kind of thing.
Dave?
And just to add a tiny bit to that, I think in addition to all of this, right, all of which I got to experience, you know, there's a piece that I think really helps to reinforce for somebody who's stepped into that lane, and that's peer support. The peer recovery groups that are out there, the anonymous, the 12-step programs, the smart recovery, the things like that, if they're done in conjunction with a lot of the things that were just spoken about, whether it be CBT, MI, or whatever it is people are using, it really helps to, it adds a connection and spiritual piece to the entire thing, and it really does help reinforce the efforts that are happening clinically.
Go ahead, Mary.
I'm gonna jump on what Dave said. We are as successful as we are because we have 5 certified peer recovery specialists on board. Most of the individuals who call our helpline, our peers are available 24/7. Most of the people who call the helpline want a warm transfer right to the peer. They start with the peer. The peer is not a clinician, but the peer helps them look at the options available to them, whether it be a support group, whether it be going to counseling, and we find it the most successful, and we evaluate those individuals who use their services, and I have yet to see anything below excellent coming back from some of these individuals using their services. The other thing in Maryland we have is, because of our training, we currently have 140 either clinicians through behavioral health organizations or private practice practitioners who were trained on problem gambling, who attend our trainings. So when we're referring, these individuals all agree to the no-cost treatment and the reimbursement that comes with no-cost treatment. We can send them to someone we know knows something about problem gambling. And we also do technical assistance to other organizations on how to integrate problem gambling into their screening and assessment. Don't make a whole new assessment, just integrate it into what you're already doing for substance use and mental health.
Thank you, Mary. Any other questions? Yes.
Yeah, I'm curious, Vina and Mary, coming from kind of the state connection work there, is the federal government supplementing any of the work that the state's doing for prevention or treatment? And like, if so, like, what does that look like, or if not, how is the state working?
I can say no, not at this moment, right? What we do receive for support and services through funding is directly through the state. Specifically, I can speak for Arkansas, that it's under an Amendment 100 that gives a small percentage for services and funding, but looking forward for hopefully increases in that so that we can have that full continuum of care for services.
I can also say no to federal funding. But what happened in Maryland when the onset of the brick and mortar casinos came is the development of a problem gambling fund. So right now, the money that goes into that fund is based on the taxes on the table games and the video lottery terminals in all 6 of those casinos, which has been okay because it's grown as we've gotten 6 casinos in the state. The problem was when mobile and online sports betting came in, the bill did not include any percentage for the center or its services or to go into the fund to be able to help in the state. And it's huge, the amount of revenue that the state is getting through online and mobile sports betting. So we've been going back at legislators for the last 2 sessions, this session as well, to see if we can get a small percentage of that, because we're seeing the young adult males who are coming to us, and like I said before, having 5 certified peer recovery specialists dealing with 600 Maryland residents is a lot. So,
As a quick follow-up, sorry. So if they did provide that funding at the state level, would it be enough to meet the need in Maryland?
it would certainly be a start. People think about, our prevalence studies, I don't know what 24 is going to show, but it's usually been around 4 to 5% of Marylanders, and people are saying, well, that's not a huge percentage. Yeah, that is. That's over 350, 400,000 Maryland residents. I think we just got to continue to work and expansion, and in this legislative session, and I don't know the results yet, it's not definite, but there's an iGaming bill, and I don't know if people know what iGaming is, but that's putting all casino games online. So we don't know where the bill is. We haven't heard pass or not pass yet. We'll hear in 10 days. But I know I did some advocating and testimony on that. I think we need to see where the online sports betting is going first.
So in my experience working in states, every state's a little different. Some states have a pretty big fund that comes from legalized sports betting tax revenue that goes towards prevention and treatment, and a lot of states have none or hardly any. So there isn't one size fits all when we look at states. Any other questions? Yes.
So, to what extent do you think school, middle school, high school programs could be effective, and what might those look like?
I'll kind of start that off. I don't know if you saw in my slide presentation, that very first slide, we started something with the high school and middle schools, especially, it's a pilot project that we're starting, but there's a prevalence there with, I would say, youth going from gaming to gambling, right? Just because of the micro bets and the way the limits and the things are designed within those games itself. We decided to be a little innovative in the state of Arkansas, and we started with Frankie the Fox to help with financial literacy from that, and to hopefully get more traction for that, to help to educate young folks through prevention services in our state, to be able to include things like that across the spectrum of the age population. So.
I know in Maryland we worked, we do presentations for schools, faculty and students, but we worked on a program called Smart Choices Maryland, which didn't start in Maryland, but we adapted that and worked with our Center for Mental Health that's on campus at the University of Baltimore, and did a video, or kind of an online presentation, figuring we could reach more people, because trying to get into the Department of Education to have another thing added to their curriculum is hard-pressed. But what we did this year, a legislator, and I don't know what the results of that bill is, there was a bill to do more education on suicide prevention within middle and high schools. So he was able to put problem gambling in that loop, because gambling has a high risk of suicide. So we're hoping that that passes and we get a foot in the door.
Dave.
Yeah, I want to link that to what I talked about earlier in terms of my own military experience. When I went into the military, I was fully aware of the dangers of drugs and alcohol, because when I was in school, I was taught about the dangers of drugs and alcohol, right? Had I been taught about the dangers and the potential dangers of, for me, gambling back then, but nowadays gaming and gambling, then maybe I would have walked into my career more armed and ready to understand that, yes, this can be a problem, and start to look for it. I think that's the place to start. You know, things like the DARE program. You know, it's just information. You're planting seeds. That's really the goal, isn't it?
Yes.
So you spoke of the need for services, the need for data, and the need for research. Is there an alignment with any federal agency that deals with problem gambling on data, on services, on research, anywhere in the federal government?
That's a great question. And the answer, I'll let anyone answer it, who wants to answer it, but I'd say, from my experience, no. There is nowhere in the federal government right now that has a natural home for gambling addiction, and that's something that we're trying to find. Where can it be that the federal government can start looking into this? It's a good question. Thank you. Anyone else want to weigh in on that, Mary?
I just wanted to say I had a meeting with someone from SAMHSA about a year ago or a year and a half ago who said gambling's an addiction, and I said, oh my God.
Mm-hmm.
So I think, yeah, we have so much more education to do. We need to have it fit somewhere, and I do know in the block grant process that our state often gets, gambling cannot be a part of it, so the state won't allow money to be used towards the problem gambling, which is really frustrating.
I just want to add that for suicide prevention, I can't speak for gambling, but for suicide prevention, much of the research besides the National Institute of Mental Health, and we would like it to be a little bit broader because we have a problem when someone's studying substance use and suicide. The substance use people say, oh no, that's mental health. And the mental health people say, oh no, that's substance use. So, it's still looking for those kinds of more specific homes, but the National Institute of Mental Health, CDC, and SAMHSA are the institutes that we work most closely with, some with NSF, and we'll work with anybody.
So we have time for one more question. Anybody else want to? No? All right, well,
Thank you.
let me say thank you to everyone who came. We really appreciate you taking the time. I see a lot of people scribbling down notes. Feel free to come up here and talk to any of our panelists if you have extra questions. And also, feel free to bring a couple lunches back to your office if you'd like for your coworkers. Just leave one for me because I haven't had lunch yet, but everyone else can take one. So thank you so much. We appreciate it.